Hello, I'm Dr. Shagufta, working at Health and Hijama Clinic, Banaswadi, Bangalore. Today's topic is IBS. What is IBS? What are the causes? What are the different types of IBS? How do we diagnose this? And what are the treatment options available for this? I will also discuss by the end of this video the best possible treatment option available for IBS. So watch the complete video. The full form of IBS is irritable bowel syndrome. It's not really a disease in itself. It's a description of multiple symptoms that when put together is a syndrome that often causes symptoms in both men and women and also in children. It's very common but thankfully not life-threatening in any way. Irritable bowel syndrome is an intestinal disorder causing pain in the stomach, causing diarrhea, constipation, and also change in the appearance of stools. The cause of irritable bowel syndrome is not well understood. The diagnosis is often made based on the symptoms. It is the most common functional disorder. The main symptoms of IBS is abdominal pain or discomfort associated with the change in your bowel habits. Patients with IBS may describe the abdominal discomfort in different ways, such as sharp pain, cramping, bloating, distension, fullness, or even burning. The pain may be triggered by eating a specific food followed by a meal, emotional stress, constipation, or diarrhea. Other symptoms include mucus in the stool, urgency, and feeling of incomplete evacuation. People with IBS may also experience symptoms not related to the intestines like migraine headaches, sleep disturbances, anxiety or depression, even fibromyalgia and chronic pelvic pain. Some people with IBS are able to tolerate their symptoms very well and can go about with their regular routine. Others find that their symptoms prevent them from experiencing a full quality of life, even including going to work or doing other important activities. Often, stress is the reason for the onset of symptoms, and these symptoms improve when the stress is gone. Some of the patients may experience random IBS episodes that have no obvious triggers. Some patients may have long periods of IBS symptoms followed by no symptoms at all for over a long period of time. To understand the types of irritable bowel syndrome, there are mainly 4 subcategories, each with equal prevalences. First is mostly diarrhea and abdominal pain. Second is constipation and abdominal pain. And the third one is alternating loose stools and constipation with abdominal discomfort. This is called IBS mixed. And the fourth one is undefined subtype, which means the symptoms can vary here. Now coming to the diagnosis part, the diagnosis is usually made by the doctor based on solely on the presence of specific symptoms and the patient's clinical history. There are currently no laboratory tests or imaging tests to diagnose IBS. A trained and experienced gastroenterologist can distinguish the classical symptoms of IBS and other symptoms that might prompt an evaluation to exclude other diseases. The diagnosis of IBS begins with a comprehensive physical exam during which you describe all your symptoms and your medical history. Your doctor may diagnose IBS based on your symptoms and history, but will also look for the red flags that suggest that you need a different diagnosis. Red flags which include the onset of symptoms in someone who is more than 50 years of age, who has unexplained weight loss, anemia which is low iron, evidence of gastrointestinal bleeding, pain or other symptoms that might awaken you in the middle of the night. If you have symptoms of IBS and a red flag symptom, you will probably need a more complete investigation. You may require further testing depending on what your symptoms are. Finding the right balance of healthy foods can be a challenge if you have IBS. Working with a nutritionist is always recommended to make sure you're still getting all the nutrients you need, no matter which diet you are on. Now coming to the medications. There are several medications that can be prescribed to treat IBS, like 1. The smooth muscle relaxants. These are best for relieving and preventing intestinal cramping. 2. Antidiarrheal medications. These medications are for those who have diarrhea. This is to slow intestinal transit to reduce the frequency of bowel movements while improving the consistency of the stool. Third is laxative. It is for those patients who have constipation as the predominant symptom. And fourth is antibiotics to help with the poorly digested carbohydrates. And finally, fifth one is low dose antidepressants. This is given if the pain and diarrhea are your predominant symptoms, and you may find relief with these medications that work on the gut's nervous system to make it less reactive for the foods that you eat, and also given for emotional stress. There is a strong connection between the nervous system and the colonic function. Stress plays an important role in the frequency and the severity of symptoms in IBS patients. A history of stressful life events or a current stressful situation can often precede IBS. Some patients who have lost their loved ones report the onset of symptoms shortly after the loss, and others with a history of depression notice that when the depression returns, their symptoms worsen. Sometimes anxiety or depression occur with the onset of IBS symptoms. If emotional stress is a trigger for your symptoms, there are several psychological interventions that might be used. The most studied is cognitive behavioral therapy, which has been shown to be effective for IBS. This type of therapy is provided by a trained mental health professional. Hypnotherapy has also been shown to help manage IBS symptoms. There are many alternative therapies also which are very effective in treating IBS problems. Certain probiotics have shown to be helpful in managing some symptoms of IBS. Yes, acupuncture can help in managing anxiety, fibromyalgia, migraines and insomnia to some extent. It can just manage your symptoms, and again we have this therapeutic massages which can reduce your anxiety and relieve your stress. Often an integrated approach that combines with these therapies works the best. Now coming to the best part of therapy, one of the best and the most effective treatment I would like to recommend is cupping therapy. Now many people ask me, how do you treat IBS with cupping therapy or hijama? So I would like to tell them that we see so many patients suffering with IBS problems, and we have found that along with the medications that the patients have already been taking, cupping therapy works superbly well for this problem. Eating spicy food triggers this problem in patients who have IBS. They tend to suffer a lot, and it makes things worse when you travel and you're bound to eat food outside, that is in the restaurants or even at the fast foods. So psyllium husk is a very good alternative to help with constipation and with diarrhea. It's a natural fiber. I suggest this to many of my patients. It works really well along with the cupping therapy. If you do not like to be on regular medications, or you want to avoid the allopathic medications completely, then psyllium husk is a very good option, and it's a natural fiber too, which can help you with your digestion and ease the bowel movements by improving its consistency. Psyllium husk is a type of fiber that acts as a gentle bulk-forming laxative. Possible benefits range from relieving constipation and treating diarrhea to managing blood sugar levels and boosting heart. Psyllium husk, similarly to other soluble fibers, passes through the small intestines without being completely broken down or absorbed. Cupping therapy is not complicated. It's a very simple therapy, yet very effective to most of our health issues, including one such problem called IBS, which has absolutely no treatment in any form of medicine. Hence, cupping therapy has proved to be beneficial. We usually suggest around 10 to 12 therapy sessions for such cases, and with every therapy session, the patient feels better and the symptoms seem to improve considerably. I hope I have covered most of the points in this video, and in case you still have some queries and doubts on this, you can feel free to question me in the comment box below. So that's it for the video. Stay tuned until my next video. Stay healthy, stay happy. Bye bye.